All right. Hello, everyone. Hope everyone is doing well. Can everyone hear me? All right, let's see. All right, cool. It looks like I'm live on YouTube. I've been having technical difficulties recently, live streaming from Zoom to Facebook and then also to YouTube, but it looks like I'm on YouTube, which is good. Hold on just a sec here. Always something here. I am live streaming. I'm just trying to get to the YouTube comments so I could go back and forth between any questions or comments between Zoom and YouTube here. Always something here. I am live streaming. Hold on a sec. There we go. Okay. All right. So thanks for joining me. And so pretty much going to give a couple of announcements, and then if you have questions, I will answer questions related to hyperthyroidism. And feel free also, if you want, to let me know in the chat where you're Zooming from or where you're attending on YouTube. I'm in Matthews, North Carolina, which is right outside of Charlotte, North Carolina. And all right, so first announcements is I will be having a free 5-day hyperthyroid symptom relief challenge. And this will be taking place or starting on Monday, August 15th. August 16th. So a week from this Monday. And so I know some of you have already attended past 5-day challenges. So there'll be a daily pre-recorded lesson that will be 10 to 20 minutes long. I think one of them might be a little bit over, maybe like 22 minutes or something like that. But for the most part, they'll be between 10 and 20 minutes. And there'll be live calls on Zoom. So again, every morning about 6 a.m., I'll send out an email, 6 a.m. my time, Eastern time. But again, they'll be pre-recorded so you could watch the lesson at any time. There will be live calls as well each day on Zoom. And I will rotate the times to accommodate those in different time zones. So I'm pretty sure the times will be either 12:30 Eastern or 8:30 Eastern. And again, registration details will be coming within a few days. So be on the lookout. I will be sending an email. And for those who are not part of I have a couple of Facebook groups, but I have one specifically on hyperthyroidism, Graves' disease. And so if you haven't joined that, go ahead, and it's in the I included a link in the email since I know not everybody's on Facebook, which isn't a problem. And so and there'll be some there'll be I think is my 4th free challenge. I've done a few longer challenges, but I have a contest. So in order to participate in a contest, you do need to be on Facebook, but in order to take advantage of the lessons and the live calls, you do not need to be on Facebook. So but anyway, so so of course it's going to focus on helping to safely manage your symptoms, even though one of the lessons is going to expand and talk about going beyond symptom management. But while trying to address the cause of the problem, we want you to be safe. So so this is a newer topic. First time I'm doing this challenge. And let's see. So we have someone zooming from Texas, actually a couple of people from Texas. And then Ilana from Palm Beach Gardens, Florida. And let's see on and then on YouTube, we have Irma from Trinidad. And let's see, Britt from South Carolina, and then Jeff from San Francisco. Okay, and someone from Palm Beach, Florida, and then Elizabeth tuning in from LA, Los Angeles, and Zanab, I'm sorry if I pronounce your name, but if I'm from New York. All right, very, very good. So all right, so that's announcement number one. So a second announcement, in my opinion, is an even bigger announcement. So finally, later this month, I will be launching a new podcast, and the name of the podcast it'll be called the Save My Thyroid podcast. So that is, the goal of the podcast is to help people save their thyroid, and so there will be an emphasis on hyperthyroidism, but if you have Hashimoto's, honestly, the goal is to also save your thyroid, too, from the damage that's taken place. But just I mentioned earlier this year that I'm focusing a lot more on hyperthyroidism and Graves, just because there's not a lot of healthcare practitioners that focus on hyperthyroidism, but there are a lot that do focus on Hashimoto's. So many of you know I did write a book on Hashimoto's in 2018, but pretty much like the challenges, for example, it's either going to be on hyperthyroidism or it's going to be mixed. So like the last one I did was on both hyper and hypo, Graves and Hashimoto's, for example. And but some of them will just be on hyper. I'm probably right now I'm not planning on doing any dedicated Hashimoto's or hypothyroid challenges. So again, it'll either be on hyperthyroidism or like a mix of hyperthyroidism and hypothyroidism. And so more details to come soon. So I'm thinking the week, pretty much the last week in August, though. Originally, I was going to do it the same week as the challenge, kind of overlap the two, but I think that'll be too crazy. And I think it's probably best just to have people focus on the podcast. Focus on the challenge. And then again, a couple of weeks later, I'll make that announcement. When the podcast, there's going to be a few episodes released initially, so 3 or 4, and then the goal is once a week. Probably the first number of episodes will just be me, just talking, just myself, just solo episodes, and then eventually it's going to be a combination: solo episodes, some interviews, and then also, I think I'm going to do some very brief, just like Q&As where I have like guests just ask questions. So anyway, you'll see it'll be here soon enough. And let's see, John from New Jersey. All right. So if you have questions about, it's again on hyper, if you have questions about, I guess, the podcast or the challenge, that's fine, but just any questions related to thyroid health, definitely let me know. And or I guess you could say even health related, but obviously the goal is to focus mainly on thyroid and thyroid autoimmunity. There are actually a number of questions already on YouTube. So and then we have Desiree from Los Angeles and Julius dialing in from Trinidad and Tobago. So we'll start, I guess we'll start with YouTube, and anybody, if those on Zoom, if you have questions, definitely put in the chat. But Sandra her question is, how do you know when you're in remission if the medication keeps your numbers in a normal range? Will your antibodies go to zero? Yeah, so like if someone has Graves, or I mean, yeah, great. What any autoimmune condition. So I work with Graves and I also work with Hashimoto's. So yeah, the goal is to normalize the antibodies. They won't always go to zero. So if they're within the range, and usually like well below the reference range, and so if like it's borderline on the higher side, I'm still not crazy about that. But yeah, the goal is to normalize the antibodies, and then over time to get to the point where you don't need the medication. So like when I dealt with Graves, I didn't take the medication. I took bugleweed as well as motherwort, but the bugleweed was the herb with antithyroid properties. And so I didn't know until, the antibodies were normal, but then also until I was off the bugleweed. And it was a gradual process. It took me, I was on a bugleweed for about 9 months. Some people are on it longer, but yeah, that was my situation. And then let's see. So Julius, I heard from natural doctors that moringa is good for overactive thyroid. How do you use it, and what are its contraindications? So I've not seen evidence of moringa. I'm familiar with moringa. Actually, I have some moringa powder, but I'm not taking it for hyperthyroidism. It just has some good health benefits. But yeah. So again, I can't say that I recommend it for overactive thyroid. Typically, again, I took bugleweed, L-carnitine in higher doses. Definitely attend if you're interested, in more of a symptom, like bugleweed and L-carnitine, and even conventional. I'll be talking about some of the conventional approaches and all other alternative approaches. Sign up for that challenge when again, it's not available for signing up yet, but it will be in a few days. And then I take magnesium, zinc, and selenium and cruciferous vegetables and rest a lot. I've gone into remission. Well, I have to take magnesium, zinc, and selenium every day for the rest of my life. No, I've been in remission since 2009, so about 12 years now. I can't say that, I take those supplements every day. So, or, that I've taken them for 12 years. So no, it shouldn't be. I'll say everybody's different. So, but yeah, most cases, those are not necessarily to take permanently. Not the end of the world though, to take, I mean, they are, minerals. So, but again, you should not have to. So Gene from Santa Cruz, California. So I'll answer this and then I'll see if there's any questions on Zoom. So I've started gaining weight even though I'm still hyperthyroid. I've been improving my diet and wondering why this is happening. So if you're still hyper, I actually wrote an article a few years ago on gaining weight with hyperthyroidism. So, if you're taking antithyroid agents, even if you're still showing as hyper, that can cause weight gain. But there could be other factors that cause weight gain. Inflammation can cause weight gain. Increased toxic load can cause weight gain. Problems with estrogen metabolism can cause weight gain. So again, there's, if your numbers are, and when you say you're still hyper, some people consider themselves hyper when TSH is depressed, but thyroid hormone levels might be normal, or sometimes thyroid hormone levels are on the lower side, but TSH takes a while to increase. So again, I wouldn't just rely on the TSH, the thyroid stimulating hormone. All right, so let's check with Zoom and see if there are any questions. Okay, so my recent blood work without medication had my lab work for T3 and T4 improved. Actually, that's kind of what I just said. So my recent blood work without medication, had my lab work for T3 and T4 improved, but not the TSH number. Why is this? And am I headed in the right direction? So, I mean, it's yeah. So I just mentioned before I saw your question that T3 and T4, even when they increase, TSH takes a while to thyroid stimulating hormone takes a while to increase, even when T3 and T4 decrease. Usually they have to be well within the reference range. And even when that's the case, it'll take time, for those to increase. So as far as if you're headed in the right direction, I mean, it's hard to say just with the thyroid panel itself, but T3 and T4, if they're heading if they're decreasing, that's definitely a good sign. All right, so I was diagnosed with hyperthyroidism in April. I've been trying to treat it naturally, but nothing is working. I've been considering taking medication along with hawthorn and dogwood. Can you give recommendations on natural herbs? So again, attend the call coming up, not the call, the challenge that's coming up where I'm going to be talking in detail. Now, again, even in a challenge, I'm not, it's going to be more, I will talk about dosing, but everybody's different. So, I can't like tell someone specifically, like, this is what you should take, but I will get into detail with bugleweed and motherwort and hawthorn and L-carnitine. Yeah, so definitely, like I said, it's going to be, I'll be sending an email in a couple of days on that, or within a couple of days, no later than Monday, but I'm hoping either tomorrow or Saturday. All right, so Lynn, I've been taking 2 teaspoons per day of 1 to 2 bugleweed for about 4 months. TSH is still negative, not sure what to try next. Yeah, so I guess it would be helpful maybe knowing if T3 and T4, like, are those well within the reference range? Because sooner or later sometimes it could take quite a while, but usually if it's helpful with T3, T4, and they're well within the reference range, sooner or later the TSH will increase. If those are not decreasing, then you might, again, the bugleweed unfortunately doesn't work on everybody, and that's why I'll be talking about different options during the upcoming challenge. And but again, sometimes, I mean, I've seen where TSH sometimes it will take like 6 months, to increase. All right, so I was so Eliana, I hope I'm pronouncing your name right. I was diagnosed with Graves' hyper after getting COVID in June of last year. I wanted to treat it naturally, but doctor said I should start methimazole and a beta blocker. I stopped medication in December, and long story short, I had to start medication again 2 weeks ago. Can I take bugleweed and L-carnitine with methimazole? So I have had patients do that. Maybe not take it exactly at the same time, but let's say if they're taking methimazole in the first thing in the morning, maybe wait 45 minutes or an hour and take the bugleweed and the L-carnitine. So not everybody does that, but if someone like you asked, if they're really opposed to taking a medication and they're they can do that to try to wean off the medication sooner than later. Again, under the advice of the prescribing doctor. So that's another thing. I won't tell anybody, to stop the medication. And I think most of you know that, but I don't want anybody to misunderstand and think I'm telling people to gradually wean off the medication. But yeah, so to answer your question, I have had patients take the bugleweed and L-carnitine at the same time. All right, so Jeff, I wear a smart ring and noticed that my heart rate variability, the HRV decreased significantly with the onset of Graves. Do you know if HRV can be used to monitor Graves? I mean, I wouldn't say specifically for Graves again. So yeah, it sounds like yeah, with the smart ring or Aura ring, which eventually I'm going to look into. I actually have heart math to monitor heart rate variability, but I've heard some great things about the Aura rings. And so HRV, of course, you want HRV to be higher, just for overall health. I can't say that HRV alone, like if your HRV is improving, it doesn't mean, you still, it's great. It's a great tool to use in between, for example, like blood tests, because you can't, obviously you can't do a blood test. Well, I mean, I guess you could do a blood test like every week, but it's for most people not practical. So either way, you do want that HRV to increase, and stress. Stress is huge when it comes to Graves' disease, and there is that relationship with stress and decreasing HRV as well. So if you get the stress under control, do some mind-body medicine, that could help with HRV, to increase HRV, which in turn could help with Graves. So I wouldn't say it could be it's a direct measurement. Like as HRV increases, it doesn't mean that your Graves is getting to remission, but it could be definitely could be a useful tool. Okay, so Britt here, if you have a slightly high ALT, and I'll get to some YouTube questions here as well. I'll go back and forth, but and I'm going to go for until about 9:30, depending on the question. So so it's 8:53 my time. So I'll go another 36, 37 minutes or so. And I'm also doing this on Saturday too. I decided to do two just because I don't do a whole lot of evening Q&As like this. I've been doing a lot of Facebook Lives on Friday at 2:00. So, but I decided to do an evening one, and then I'll be doing another Zoom call live stream to YouTube on Saturday, 3 p.m. my time. All right, so getting back to Britt, if you have slightly high ALT on a liver panel without taking methimazole, do you have suggestions for that root cause, vitamin D deficiency, or other tips for lowering? I mean, hyperthyroidism itself could put some stress on the liver enzymes, so a lot of things can put stress on the liver enzymes. I mean, just we live in a toxic world, but just hyperthyroid, you don't have to take methimazole for the ALT to be increased. So, some of my patients will take, milk thistle or glutathione, like a liposomal or acetylated glutathione, to help support the liver while doing things, of course, to reduce their toxic load, which you might already be doing. But like I said, it very well could be related to hyperthyroidism itself. Vitamin D deficiency usually is not going to cause high liver enzymes. But if someone has vitamin D deficiency, you do want to address that. So question here, what do you recommend for helping sleep for hyperthyroidism-induced insomnia? So if it's due to the hyperthyroidism, you really do need to get those levels down. For some people, they're not going to get sleep until the thyroid hormone levels are normal. In some cases, that might mean taking the medication. You certainly can look into, natural methods such as, bugleweed, which I took, or L-carnitine, but, like some people will ask, well, can I take other things for sleep, like melatonin or GABA or L-theanine, which I like L-theanine, for example, and even GABA, but and I'm not saying they can't help, but if the cause is the elevated thyroid hormone, then usually these other sleep supplements aren't going to help. Sometimes cortisol, a lot of people with hyperthyroidism have cortisol imbalances, which is why I recommend saliva testing. But if someone has high cortisol, then taking something like phosphatidylserine or Relora or even ashwagandha, which there is some controversy with ashwagandha, especially being a member of the nightshade family. But again, if it's related to the hyperthyroidism, then you really want to go ahead and do things to lower the thyroid hormone levels, which again, that's what the upcoming challenge is about. The goal is to address the cause of the problem, but trying to, be safe. And there's other reasons to lower thyroid hormone levels, just in the potential stress it could put on the heart, but then also the bone density could have a negative effect on bone density as well. All right, so I'll get back, John, I'll get back to your question, but so Irma, I feel as though my body's on fire. This is from the YouTube chat. And yeah, I mean, with hyperthyroidism, that could sometimes have that feeling. Some people wouldn't describe it as body on fire, but night sweats, like feeling really hot. So again, the trying to decrease those thyroid hormone levels is important. And then Julius, Dr. Eric, when I was very sick, your information from Dr. Isabella Wentz helped me a lot. I just want to say thanks. You're a blessing. You are welcome. Thank you for that, Julius. And then Mary has a question. Does Graves' disease cause high cortisol or vice versa? I've lost weight, everything else except for my stomach and face. That is a sign of high cortisol. So no, Graves doesn't. Actually, when I dealt with Graves, I had low cortisol. So I've seen both. There's no really correlation that applies to everybody, whereas like Graves causes high or low. And as far as you put, does Graves' disease cause high cortisol, vice versa? So like, can high cortisol cause Graves? So high cortisol can cause dysregulation of the immune system and can potentially be a factor with the development of autoimmune conditions such as Graves. It's something that happens over time. But you lost weight, but your stomach, I guess your stomach and face. So it could be cortisol, it could be something else going on, just swelling. I mean, yeah, so like the face isn't always a sign of cortisol, but that's also why I like to test. I don't like to guess when it comes to adrenals. Some practitioners don't test for adrenals, but I would recommend either saliva testing or dried urine testing, like Dutch testing. All right, so John, do you have any familiarity of laser ablation to remove thyroid nodules? I have a 4-centimeter nodule, FNA biopsy negative, endo once, entire thyroid removed. So coincidentally, I can't say I have a lot of experience, but coincidentally, one of my patients today, I was chatting with her. She got about a month ago radio frequency ablation. So there's not a lot of places that offer that. She got it from Columbia Hospital in New York. She also said NYU has it. And then there's, I think, University of Virginia. There's a place in Texas. I mean, there's more places, I'm sure, now than I know a few years ago, I think only like Virginia and Texas. And but so she actually had a larger, I think a few nodules, but one of them was larger, and she got the procedure. I mean, it's not doing anything for the cause of the problem, which she knows, and so she's still working on trying to address the cause of the problem. But she says it has, like it. She said it was, like you could actually see, I mean, yeah. Anyway, so. She's still waiting on the like follow-up ultrasound sonogram, so not sure what that looks like, but I know she said they didn't offer any sedation and it was very uncomfortable. She was saying it was very painful. It was like a 90-minute procedure. And so yeah, so again, that I had a patient who also got it in the past, but she lost touch. She didn't, she went right after she got it, she touched base and it sounded like it worked. They did, I think, a follow-up ultrasound and showed that, again, it was, I mean, what you expected to, it does seem to be pretty effective. And I wrote an article, not specifically on radiofrequency ablation, but on toxic multinodular goiter. So if you visit Natural Endocrine Solutions, do a search for toxic multinodular goiter, I do talk about a little bit about different, not actually radio frequency. So you asked about laser. So she got radio frequency ablation. I spoke a little bit about laser ablation as well in that article. I don't think I've had any patient do laser ablation. I've had a few do the radio frequency ablation. Again, the concern is that it can come back. And so and I think I've read. I don't know if it was in the Facebook group or something where someone received it and it worked, but they did come back. So you still want to address the cause of the problem. And the person I spoke with today, she was like, I definitely want to get to the cause of the problem because again, very, she said very uncomfortable. I mean, again, it's only 90 minutes. I guess if someone had to go through that, again, not that I didn't go through it, so it's easy for me to say, but but I guess if it was every few years, but really you want to try to, again, address the cause of the problem whenever possible. All right, so let's see. So this is I think this is a private message from Zoom, so I'll read it out loud without saying the person's name. But I take 2.5 milligrams of methimazole and I want to now switch to bugleweed. I got the drops 1:3 ratio in the tea. My question is, how much should I be taking daily from the drops and from the tea to substitute the methimazole? That's a common question, but there really is not a conversion for that. It's based more on the thyroid hormone levels, but if you're taking a lower dose, like 2.5 milligrams of methimazole is a very low dose. So like for a 1:3, I don't really think tea is reliable, so I'm not going to answer as far as like, tea. Like to me, bugleweed tea is, I mean, you could, I guess someone could drink like a cup or two a day, but it's probably not going to have much of a therapeutic effect. But 1:3 ratio, I would say, and again, this is just general. I'm not saying this is what you should take, because again, if you are a patient, I'd want to still see like the thyroid panel, and but I would say maybe like a teaspoon or 5 milliliters per day. So Tora asked, does bladderwrack, sea moss, and high dose selenium help with hyperthyroidism? So bladderwrack, so you're asking like, using iodine sources, which, so it could go either way. I'd be very cautious. I probably would not take that approach because, high dose iodine can have an opposite effect and it could lower, even though, so iodine is important for thyroid hormone formation, but taking higher doses can, it can also in some cases lower thyroid hormone levels. But it could also do the opposite. It could increase hyperthyroidism, or in the case of Graves, could exacerbate the autoimmune response. Selenium, again, I don't know what you mean by high dose selenium. Like 200 micrograms is this common dose, but if you're talking about like 400 to 600 micrograms, possibly. I can't say I give that high of a dose to most of my patients. All right, so free T4 is normal, but TSH is low. Can that cause insomnia? Typically, no. Typically, since the actual thyroid hormone level is not elevated, that shouldn't be the cause of insomnia, the low TSH. I'm going to take a quick sip of water. If anybody else on YouTube has a question, definitely let me know. Yeah, at first we were getting no questions from Zoom and everything from YouTube. Now it's the opposite. So, and I'm going to go again another like 25 minutes, but I'll be live on Thursday, and then I'll probably do another one next week. And then again, the whole week of the challenge. So that's completely free. So if I, for any reason, don't get to your questions, again, there'll be other opportunities. But Carol asked here, I have Graves, third time out of remission in 42 years. Wow. So endo changed my low dose thyroid extract to thyroxine and T3. Okay, so thyroid extract to thyroxine T3. I became terribly overactive. Okay, now on methimazole, seems okay. So kind of on like block and replace therapy, I guess. Um, but given melatonin seems to cause elevated thyroid hormone again. I feel it, so I've stopped. Ashwagandha also made me hyper. Seems best to stay away from these. Also, blood sugar all over the place and heart arrhythmia from time to time. I mean, listen to your body is what I would say. So ashwagandha, I've had a lot of patients do okay with ashwagandha, but I've also had some that take ashwagandha and they say they feel more hyper. Um, it does affect the HPT axis, the hypothalamic pituitary thyroid axis. Um, but yeah, melatonin, I can't say, again, I don't have a lot of patients on melatonin, but I do have some on melatonin with both hyper and hypo. And, most cases that's not going to um, increase thyroid hormone levels. But again, listen to your body. If you feel like it's having that effect, then I agree that stopping and yeah, so blood sugar all over the place. Again, diet could play a big role, but sometimes like if someone has like insulin resistance, that's also there's an inflammatory component. And and yeah, heart arrhythmias, again, just making sure. That's why again, I'm having this challenge, just to people be safe, and for those who currently, like to try to prevent people from having issues like arrhythmias or going to thyroid storm or even decreased bone density. All right, so let's see. I'll go to YouTube for a couple of questions and I'll go back to Zoom. So Ray, I'm very young with Graves' disease, and I apologize if I didn't pronounce your name correctly, but I'm very young with Graves' disease. What should I look out for and avoid or do to improve and not get worse as I get older? So remember, Graves is an immune system condition. And so, there are different factors that could trigger the autoimmune response. And so so food. So I definitely would clean up your diet, eat healthy, which is difficult. I mean, not for everyone, but a lot of people find it difficult when they're not eating healthy and making a switch. Not just those who are young, but adult, older adults as well. So, but diet is extremely important. Stress management, blocking out time on a regular basis for stress management. Trying to do things to decrease your toxic load. Uh, just like trying to eat organic as much as possible and using natural cleaners and cosmetics. There could be other factors such as infections, but try to do as much as you can from a diet and lifestyle perspective. And yeah, definitely check out, if you haven't done so already, visit my website, naturalendocrinesolutions.com. Be on the lookout for my podcast. That's the goal of my website and my future podcast, just continuing to give what hopefully people perceive as being valuable information. Obviously some people do need more individual support, to just keep that in mind, but just of course, take advantage of the free information as well. And then Gene asked, to get high doses of L-carnitine, do you recommend the liquid? No, I mean, you could use there are some liquid formulations, but usually I do, yeah, I usually recommend capsule just because compliance is better. And not everybody will take I didn't take L-carnitine, but usually I recommend like 2,000 to 4,000 milligrams. So, I mean, if someone's taking 2,000, and L-carnitine usually comes in 500 milligram capsules, so taking like 2 twice a day, not a big deal. Someone's taking 4,000 and 4 twice a day, that's 8. That's obviously twice as much. That's, for some people that, and then they're taking other things. So I can understand what might seem as much, seem like it's too much. So, but you could, take it in liquid form as well. So Britt, CBD oil seems to work for me and many people for the heart rate elevation. It can help you sleep. Yeah, that's true. CBD oil, again, everybody's different, but it can help with sleep and anxiety and inflammation in some people. So that is something, for some people to consider. All right. So what type of lifestyle do you recommend for Graves? Since you achieved remission, have you kept the same lifestyle? No, I mean, I'm definitely not as strict as I was when I was dealing with Graves, because I don't think anybody, well, I shouldn't say this, but I was gonna say, like, as far as diet, I'm definitely really healthy, but I was gonna say, when you're trying to restore your health, you want to be, um, really disciplined, but I don't expect people to be perfect, especially like when, in remission, when trying to restore the health, I would say try to be as perfect as you can. But yeah, I'd be lying if I told you that over the years, I haven't indulged and fallen off the wagon with the diet. But I'm pretty good about getting back on the wagon. So like I won't go like weeks or months, like eating bad or things like that. But if I'm out of town on vacation, even then I'll try to eat healthy. But again, I can't say that I never stray from the diet. But most of the time I'm eating whole healthy foods, plenty of vegetables, trying most of the time to be gluten free, and most of the time dairy free. Dairy I stray, like again, I do like pizza, and no problems eating gluten free pizza, but I can't say I always eat dairy free, or usually honestly I don't eat dairy free pizza. So even though there is like the dia, anyway, so um and sometimes a little bit too much sugar, like like many others as well. So again, I have my weaknesses too, which hopefully gives people motivation too, that you don't have to be perfect. Stress management, definitely much better, because I really wasn't doing anything when I was dealing with Graves. Like when I first was diagnosed, I should say, with Graves, and then so that's something I do regularly. Sleep, I'm really good about. And then one thing I really have focused a lot on is doing things to reduce my toxic load. Again, trying to be organic as much as I can and using natural cleaners, cosmetics. I do sauna, infrared sauna a couple times per week. Not everybody does that. And to be upfront, I've been in remission again since 2009, and I've only been doing sauna since, I forget, either 2014, 2015. So I mean, it's still a long time, like at least like 5, 6 years. But I 5 years after being diagnosed with Graves, I was not doing sauna, so I can't say that's absolutely necessary. But those are some of the things I do. I just not perfect, but definitely I'm aware that again that I feel better too. It's not just the Graves, but just overall, when I'm eating better and managing stress and getting enough sleep. So yeah, so hopefully that answers your question. All right, so Eliana, I've read lemon balm is good for Graves. What are your thoughts on it? So again, I'll talk a little bit about lemon balm during the challenge, but I'll say here that so I didn't take lemon balm when I dealt with Graves, but I have patients that take it. That's something maybe that could help with sleep, like has that calming effect. But again, it depends on the cause of the problem, sleep, anxiety. So when someone takes lemon balm, usually I recommend it in the evening, or some people will drink lemon balm tea. All right, so if thyroid binding globulin is 26, range of 13 to 26, is that okay since it's still normal? I mean, it is kind of on the higher side. I would like to see the other numbers too, before set, and like if, because it is, again, I like to see things, in an optimal range, but again, I wouldn't panic just with that alone. So the good news, it is within the range, that it's not elevated, but yeah, I would like to see the whole picture. So Britt, have you seen an increase of patients with thyroid issues after COVID vaccine or virus? As the person mentioned above, their diagnosis came after COVID. Um, yeah, I've seen both, where I've seen people who have gotten, there's a risk with COVID, there's a risk with the vaccine, I guess is the best way to say it. And I've seen both. I've seen people who have, gotten COVID, and that, increased that like exacerbated the autoimmune response. And then, and there are people who have gotten COVID. I haven't had a patient who came to me because they developed, like, let's say Graves or Hashimoto's after getting COVID. Same thing with the vaccine, but I've had some patients get the vaccine, and it exacerbated the autoimmune response. And in some cases that was temporary, where it was like, for a few weeks and things seemed to go back to normal. There's been a few cases where it's been more prolonged. And then the Facebook group, which of course anybody is welcome to join. I can't say I spend a lot of time in the group, just because, I just got a lot of the group is more for others, just connecting. But every now and then I'll see people asking questions. I'm sure there are a lot of questions on the COVID vaccine, but I have taken, it's been a while, but maybe like a few months, but I've seen where some people, got the vaccine. They had no history of Graves or Hashimoto's, and then got the vaccine, and then, then they were diagnosed. And then again, some who already had Graves or Hashimoto's and got it. But then also, to be upfront, there's people who with Graves and Hashimoto's who have gotten the vaccine and no problem. So, what I learned, that, I don't want to go on too long about this, but, I know with the mRNA vaccines, so the Moderna has 100 micrograms of the mRNA, whereas the Pfizer only has, I think it's 30 micrograms. And so again, it's that greater immune response with the Moderna, so greater risk. If you're choosing between the two, not to say there's no risk with Pfizer, but or even the other ones, but yeah. So all right, let's see a few more. I'm going to go another like 10 to 12 minutes. But Patricia hasn't asked any questions, and she has a couple in the YouTube chat. So I have Graves and I get cankers in my mouth more frequently. Do you know why? I can't say what Graves everybody, I was going to say, I haven't seen that correlation, but, there are people like there's, so I can't say that's a classic symptom. There's always going to be, like, if you ask people on Zoom and on YouTube now, I'm sure there might be a few others who say, yeah, now that I think of it, I'm getting more canker sores. I can't say that's the case with most people, but so I would look into nutrient deficiencies. The elevated thyroid hormone level itself probably is, from what I understand, is not, or let's word it a different way, not from what I understand, but I haven't seen any research showing, or again, a correlation with like most patients where elevated thyroid hormone levels result in increased, canker sores. And then Patricia also said, I changed from Hashimoto's hypothyroid to hyperthyroid just after the COVID vaccine. So it sounds like maybe the COVID vaccine kind of exacerbated those Graves antibodies. And again, sometimes, I've seen it where it's just temporary, but there have been some patients where it seems like it's more prolonged. All right, so Eliana, I was told by my primary and endocrinologist that my goiter will not go away. What's your experience with this? I started an anti-inflammatory diet 2 weeks ago, so hoping it helps. I'm also concerned about thyroiditis. Any suggestions for it? So I would say visit my website, naturalendocrinesolutions.com, and there's a little search bar, and you could do a search for thyroid swelling as well as thyroiditis. I do have some articles on those. Goiter. So I had a mild goiter when I dealt with Graves, and it normalized. If someone has a real severe goiter, it's probably not going to completely normalize. It might decrease. So it depends. If it's real severe, then yeah, your doctor's might, probably right where it won't completely go away. It depends on the severity. But if it's more mild and even moderate, I've seen those normalize. And if it's, severe, it doesn't mean it can't shrink, but I wouldn't expect it to go, like to where it's, back to where it's like its original size. Thyroid eye disease, again, it's more of an immune system condition. So same factors that cause the autoimmune response in Graves, will cause the autoimmune response in thyroid eye disease. So, again, definitely check out some of the articles on my website. I also interviewed an ophthalmologist a few months ago, Dr. Ronnie Bannock. And so there's on my YouTube channel, there's the interview, natural thyroid doctor. And then also I transcribed it and have it as a blog post too on my website. All right, so there's certain brands that you recommend for bugleweed and L-carnitine. So, I mean, bugleweed, I used MediHerb, and that's usually what I recommend. Some patients use Herb Farm, which is good quality but lower potency. L-carnitine, I forget the brand again because I didn't, I didn't personally take it, but also it's not something I recommend. I can't say like, most of my patients I recommend L-carnitine. I do sometimes, and I just forget in the brand. I know like Designs for Health does have a good brand of L-carnitine, but there's one or two others that again I'm not thinking of. So Karen, I had to up my T3 amount from 1.5 micrograms to 4 micrograms. What can I do to stimulate T3 production conversion? I was under some prolonged stress, but have that at a minimum. Well, the question is, are you, so a lot of people have problems converting T4 to T3. So it's not necessarily a stimulation, which I think you did put there too, stimulate T3 production conversion. I mean, the thyroid does produce, even though it's producing mostly T4, it is producing some T3, but most of conversion happens in the liver, about 60%. So doing things to improve health of the liver, even just reducing your toxic load. 20% of it takes place in the gut, which is for a lot of people work in progress, trying to improve gut health. Adrenal imbalances could also be a factor. Sometimes selenium deficiency, but usually that's like more severe selenium deficiencies. So, and again, visit my website, naturalendocrinesolutions.com, and I would type in conversion, and I do have an article that discusses 6 different factors that could help with conversion of T4 to T3. And thank you for sharing. You are welcome. All right, so TSH 1.44, which is excellent. Reverse T3. So the 20, which is kind of on the higher ends. So TBG 26, free T3. Yeah, free T3 and free T4 look really good. So, yeah, so honestly, I would probably not consider with these numbers. I mean, because again, free T3, free T4, TSH, all look really good. They're like all within optimal. And then reverse T3, that is a little bit on the higher side. Yeah, so TBG again 26. Like I said, just I could be wrong. Everybody's different, but yeah, like since everything else, well, not everything else, reverse T3, but that I'm not really relating that to the TBG, and looking at the thyroid panel, again, thyroid panel looks awesome. All right, someone else mentioned I developed hyperthyroidism after having COVID. And Eliana, when I caught COVID, I was also going through a divorce and my stress levels were extremely high. Doctors have attributed my Graves to the fight or flight state my body was in. So yeah, I mean, so it's, yeah, if you had, extreme stress, and the COVID, obviously that's a stressor too. It's hard to determine what is what. Okay, so YouTube here, question, with Graves' disease, I'm never hungry. Do you know why? Whenever I do eat, sometimes I can't stomach it down or it makes me sick. Yeah, so it's probably not I mean, most people, it's the opposite. When I had hyperthyroidism, I had a voracious appetite. Um, so there's probably other imbalances going on. It's not, hyperthyroidism, you get that increased metabolic state. And again, so usually you get the voracious appetite. So I'm thinking again, something else, maybe with a factor that potentially is a trigger. Like sometimes when people have stealth infections, that could be a trigger, for example, of Graves, but could have a negative effect on appetite. All right, so okay, answer this question. So where is the best place to purchase bugleweed? I don't know. I mean, so you could, uh, contact our office about it. Speak with Kate, just send an email to staff@naturalendocrinesolutions.com. Again, some people will just go online, and the herb farm, not everybody needs a higher potency of bugleweed. So some people take the herb farm, which, like I said, it's good quality, just lower potency. And that is something people could get on their own. The Medi herb is one that's through practitioners. I mean, you might be able to find it on Amazon. I would just be with any supplement, I would say, if you get it on Amazon, definitely get it from the source, like get it from the company. Don't just get it from random sellers, just because you don't know how they're storing it. And also, there's a lot of counterfeiting. Okay, so Britt says, appreciate you doing this and sharing your knowledge so freely so people can get well and feel and be the best version of themselves. Yes, you are very welcome. And also I should have announced earlier, tomorrow, for those on Facebook, I'm doing a Facebook Live and a unique interview, one I've never done before. Like I've never written an article or done any type of video on breast implant illness, but I've had a few hyper patients, where that potentially was a factor. So that's why I decided to, and it could also be with Hashimoto's too, but just in, so far I haven't come across, I don't think any patient with Hashimoto's with that, but anyway, it could be a factor with autoimmunity. So, if you have breast implants or know someone with breast implants, because it's not just thyroid, it could cause other issues, but you might want to either check it out or tell them to check it out. So that'll be tomorrow, 2 p.m. Eastern time. Will be recorded for those who are unable to attend live. But yeah, I enjoy doing these Q&As, and we'll enjoy the interviews. I'm going to enjoy my podcast because that's going to involve me doing more interviews. And the solo episodes I enjoy, but they're honestly, I really like doing interviews. The challenge is also going to be fun, even though that's of course solo, but the recordings. But and then Marion says, I take Herb Farm Bugleweed. I missed the other brand you mentioned. Would you tell us again, please? So that's Medi Herb, MEDIHERB. And then Eliana, thank you so much for sharing. And then thank you so much for your informative information, for answering our questions. I appreciate the time you take to help us. Can't wait for the podcast. Yes, I'm excited about the podcast too. So nervous about mentioning it because my goal was to get the podcast released last year in 2020. But then when all the COVID stuff started happening, I just decided to do online challenges rather than the podcast. And so I kept on delaying it, but I'm pretty sure it's going to, I mean, I'm saying late August, and I'm pretty sure it is, just because, again, if there's any delays, it's not going to be due to the content. It'll be due to technology, just because that's all new. But the content, I pretty much, there's some, episodes, like still some editing and stuff to do, but that could be done pretty quickly. But the technology will be new. So anyway, that's why I'm not giving a specific date. It might be August 30th, but I'm putting the week of that because the goal is probably on that month, Sunday or Monday, to have it live. But again, since it's brand new, there might be a delay. I can't imagine it taking more than a few days of a delay and working out the bugs or whatever. So then another here, thank you so much for taking your time and answer all the questions and sharing your experience with us. And then Carol, I missed your challenge announcement. Please tell us again. So let me, So this is the challenge announcement over here. On the slide here. So just, again, it's going to be a hyperthyroid symptom relief challenge that will be taking place. It's showing here that the screen sharing is paused. But anyway, so August 17th is when the challenge is going to, I'm sorry, August 16th, Monday, August 16th, that week is the challenge. Okay, I think it's sharing again. And I haven't released the link to register, so that will be coming in the next few days. And Irma says, thank you for sharing and you are welcome. And all right, well, let me stop the share. And all right, well, thank you everyone for attending. Appreciate you tuning in. Maybe I'll see some of you on Saturday, and if not, hopefully I'll see hopefully all of you during the challenge. So again, I'm going to be rotating the times during the challenge. The lessons will be pre-recorded, but I'll be doing Zoom calls 12:30 and 8:30. Again, there'll be a schedule once you register. And again, I hope everyone has a wonderful night. Thanks again for tuning in. Thanks again for your questions. And again, I'll hopefully see some of you, maybe see some of you tomorrow too during the Facebook Live. All right, take care, everyone. Bye.